and welcome. This is Health Matters on Channels Television. Thanks for joining us. I am Mary Alale Yusuf. About 300,000 babies are born with blood disorders every year. More than 200,000 of these are cases of sickle cell anemia, and more than 3/4 of this number are born in Nigeria. This translates to over 150,000 people with the sickle cell disorder being born in Nigeria every year. The 59th World Health Assembly has urged member states in which sickle cell anemia is a public health problem to reduce the incidence, morbidity, and mortality associated with the condition, and to try and make emergency care available, as well as train professionals and volunteers. My guest on the show is a consultant hematologist at the Lagos State University Teaching Hospital, Ikeja, and has been involved with the Tintayo Awushika Help Foundation, or TAF for short, since 2000, when TAF and LASUTH entered into a partnership. Dr. Doyin Dosunmu, you're welcome to the show.
Thank you for having me.
We never get tired of saying this. Some people are just confused about how people get the sickle cell disorder. Could we run through that again?
Well, sickle cell disorder is a genetic abnormality. It's inherited as a result of an abnormality in the structure of the hemoglobin. That is the element that carries blood that carries oxygen rather in the blood. And when you have, you inherit from the mother and the father. When you inherit from the mother, the gene, the mutant gene, and then the father, you inherit the normal gene. You are AS.
Okay.
When you inherit the mutant gene from the mother and the father, it is SS.
Okay.
And so when an AS and an AS, man and woman, marry, they tend to produce, for every childbirth, there is 25% chance of that child being SS.
So the mother and the father must contribute a trait.
Exactly.
It cannot be contributed by one person.
No.
Okay. So that's sickle cell disorder. 25% chance of them having a...
Every child, every birth has a 25% chance of being SS, sickle cell disease.
You know, some people get confused. Some have looked at the diagram and they've said, okay, I'm about to have children. Let me just have 3. Because I know the 4th one is likely to be SS. So I'll have AA, then I'll have 2 ASs, and then I'll stop having children.
It doesn't
Can you
work
talk
like
about
that? What it says is that every birth you has 25% chance of being a sickle cell patient.
So every time a woman is pregnant, it's like throwing dice.
Exactly.
It could be anyone.
So you can be AA, it can be AS, it can be SS. Every child you have. So you can have 4 children that are all AS. You can have 4 children that are all SS. So each time you give birth, that is why it's advisable to do the prenatal diagnosis. But that one has its own pros and cons. So for every pregnancy, you'd see whether the pregnancy is SS or AS or AA.
Okay. Now, the 59th World Health Assembly dealt in depth with this issue and came up with, recommendations. I'm interested in reducing incidence, morbidity, and mortality. Let's start from morbidity. Morbidity means sickness, isn't it?
Yes.
But, okay, before we go there, let's just quickly run through the symptoms of a sickle cell disorder. It does have symptoms.
Yes, sickle cell can present with either a crisis or complications. So the symptoms will depend on what the patient presents with. If you say crisis, you have pain crisis, that is vaso-occlusive crisis, in which case the patient presents with severe pains, moderate to severe pains. And then it could be so severe that you have to use some drugs that may knock the patient off.
So severe as to interrupt the person's day-to-day activities.
Exactly. That's a severe one. It could be mild and moderate. And as the child grows, or as the child grows up, the child tends to adapt to the pain, and then the pain threshold tends to modify, sort of. So each presentation, there's a variation, a large variation between individuals as to the presentation of the pain. Then that's painful crisis. You have what is called hyperhemolytic crisis. That is, the red cells are being destroyed rapidly, either due to an infection or due to a stress or whatever, or some drugs that the patient has taken. Okay, there's hyperhemolytic, the rapid destruction of cells, in which case the patient comes up with weakness.
Do the cells look like this?
Oh, that's a normal cell.
That's a normal cell.
Yes.
Okay. Okay, the cell, it looks like it's about to change.
Okay, that's getting sickled.
Okay, so this is what happens to a person with the disorder. The cells look like this?
The cell looks like this. That's a sickle cell. Look at it.
What's the implication of the cell looking like?
As it's going now, you can see that it's clogging the vasculature of those are the blood vessels.
Okay.
Okay, as they are going, because of the cell, when it becomes sickled, loses the ability to get deformed. It gets to that area of that vessel that cannot pass again, cannot flow through again. So it will clog that vessel. Clogging that vessel means that any tissue that vessel supplies will be compromised.
Okay. And that could happen in any area of the body?
Any area of the body.
So blood supply to the liver could be compromised, to the kidney, to the brain even?
To the brain, to the eyes, to the bones, to the skin.
Okay, that's another picture of... do you call them lysed cells?
No, they are not lysed now. Now, if they deform like this, they lose the ability to deform. When they get to a point in an organ in the body, which we call the spleen, it becomes, they get arrested there.
Okay.
And they are easy for the cells that engulf damaged cells to engulf them and destroy them, thereby reducing the lifespan of the cells. Okay, another thing is that...
that's why it's called anemia.
Anemia, yes.
Because the person doesn't have it or has had a lot of blood destroyed. But the blood, the body is supposed to make its own blood, isn't it?
Yes, beautiful.
So does it now compensate somehow?
The blood is made in the marrow of the body. That's the marrow, the center of the bone. There, the center of the bone has the capacity to increase its activity, that is blood-making activity, by up to ×8. So when you have such a case, you have, normally the red cells have a lifespan of 120 days. In sickle cell disease, it may be reduced to as far as 15 to 20 days.
15 to 20 days.
So the marrow has to compensate for that. And that's why we give folic acid and all sorts of drugs to vitamins to really help the marrow.
Pace.
Yes. So you need, the marrow is trying to struggle to keep up the pace with the destruction.
Now we understand that the vessels, organs could be compromised by the blockage of vessels with those type of cells, with the sickled cells. But does that also cause that pain crisis you're talking about?
Yes.
The blockage of vessels causes the pain crisis.
The principal factor in the cause of the pain.
Okay.
See,
so that means that pain
yes,
should be an indicator of an emergency then in a sickle cell patient.
Yes, it is. In fact, if you're having pain for more than 5 days, 7 days, you might need to give blood to reduce the consequences on the tissues. So, because once the tissue is clogged, the issue is that once the blood vessel is blocked, all that reaction of the body comes in. We call it inflammatory reaction, involving the lining of the blood vessels, the other white cells of the blood, and so on. They release chemicals, called cytokines, that can cause pain.
Okay.
That can cause fever and so on. So, the reaction of the vessels, with the reaction of these white cells, and the reaction of the sickle cell all contribute together. One starts the other. All contribute together to cause the pain and perpetuate the
Now,
problem.
you've told us about some of the symptoms. Do tell us about complications, because you were making a demarcation between symptoms and complications. What are the complications?
After recurrent blockage of the vessels and reopening of the vessels that occurs during in a sickle cell patient, the tissues, that is the organ that these vessels serve, they get compromised. So you can have situations where each organ will manifest at various times, at the various age of the patient. So you can have leg ulcers because the circulation to the leg is compromised and the tissues around the place are compromised. You can have osteomyelitis because sickle cell as well, they are prone to infection. Yes, infection of the bone. They are prone to infection. So they can have osteomyelitis. They can have the bones actually dying. That is necrosis of the bone.
Bones die?
Yes, especially the bones of the hips. Okay. The head of the bone that carries the weight of the body when you stand up. The head has a singular supply of blood vessel. And once that supply is affected, that head dies off.
Okay, that's why they keep having hip replacements.
Yeah, hip replacement. So they have to replace that area that is dead. That's a complication too. Okay.
But is there a way that a person doesn't have to get to this point? The point where he has to have a hip replacement, the point where his organs are compromised. Is there sort of like a check, an indication that makes people come in and act and prevent those things from happening?
Yes, this is the main challenge in sickle cell disease. To be able to predict crisis, to be able to say this patient is likely to have this problem. See, this is the challenge we have with sickle cell disease. It's difficult because people vary. And somebody who is doing well today by tomorrow. But generally, a good nutrition, moderate exercise, prevention of infections, taking vaccinations and antibiotics at the prime period of life, preventing dehydration, that is to take enough water. There are so many things people are developing to do that. And then when you have crisis, you intercept in time before it gets to the problem of damaging the organ.
Okay, we need to go on a break now, but when we come back, we'll talk more about this crisis and some other issues. Please stay with us. We're going on a break now, and you know that the most exciting part is coming after the break when you get to call in. And please do tweet so that your questions can be taken if they come in time. Stay with us.